Hello everyone, welcome to my YouTube channel logicmedico. Today's topic MCQs in ENT year part 6. Let's see these MCQs. Identify the test. The test is shown in the picture. Is it bone conduction test, speech testing, tympanometry, pure tone audiometry, acoustic reflex testing? Time starts now. Time is up. Answer is pure tone audiometry. So this is a pure tone audiometry where the person is in one airtight chamber wherein all the external noises are avoided and is wearing one headphone through which the pure tone was given audiologist. Okay, so they are specialized in this. Next question. Which threshold of hearing is measured by using pure tone audiometry? Is it ear conduction, bone conduction thresholds of hearing, speech reception thresholds, ear conduction thresholds of hearing, or only bone conduction thresholds of hearing? Your time starts now. Your time is up. Answer is ear conduction and bone conduction thresholds of hearing it will measure. And both the ears it will measure, right and left ear, both the ears. It will compare the thresholds of ear conduction and bone conduction with respect to one another, with respect to the same ear and the opposite ear. Okay. Next question. Decibel expresses the logarithm of ratio between two sounds. Options are, which are those two sounds? Powers, pressures, intensities, all of the above. The time starts now. Your time is up. Answer is all of the above. So the logarithm of ratio between, that is log of ratio between two sounds with respect to powers or pressures or with respect to intensities. So it is a comparison between two different sounds. Okay. Next, what is the unit of dB? Options: watts per centimeters, unitless, watts per square centimeter, dynes per square centimeter. Time starts now. Time is up. Answer is, it is unitless. Okay, this is decibel, because the ratio between the two will cancel one another, so it will not have any units. So decibel is a unit for expressing the ratio between two physical quantities, usually amount of acoustic power or the electric power, or for measuring relative loudness of sounds, that is with respect to intensities. So they will cancel one another and there won't be any unit, okay, for decibel. Next, sound intensity is proportional to dash of sound pressure. Is it square of the sound pressure, square root of the sound pressure, inverse square of the sound pressure, or cube of the sound pressure? Your time starts now. So if you are told option A, then your correct answer, you have got the correct answer. It is a sound intensity is directly proportional to the square of sound pressure. So for example, sound pressure is 2, so sound intensity will be 4. That is the meaning of that. Okay. Next, unit of sound intensity is it joules per centimeter, or joules per square centimeter, watts per square centimeter, or watts per centimeter? Your time starts now. Time up. If you are told watts per square centimeter, then it was correct answer. That is, sound intensity is measured in this unit. Okay, watt per square centimeter. Next question. Sounds can enter the inner ear through the bones of the skull. This is called as, your options are bone reception, bone adaptation, bone conduction, bone adoption. Your time starts now. Time up. If you are told bone conduction, then you are told the correct answer. So basically we hear through two ears. We have two ears, right and left ear. Each ear has got the ability to hear through air and as well as through bone. Okay. So air conduction is slightly better than the bone conduction, but we can also hear through our bone. So that is called as bone conduction. Okay. Human ear respond to the vibrations of sound ranging from dash to dash. Your options are 2 Hz to 2 kHz, 20 Hz to 20 kHz, 2 Hz to 20 megahertz, 20 kHz to 20 megahertz. Time starts now. So if you are told option B, then you are told the correct answer. Answer is 20 Hz to 20 kHz. How to remember? Both are 2020. You remember 2020 cricket and all now. Kindly remember this 20 Hz to 20 kilohertz. So beyond this and below this level, that sonic vibrations we can't hear. But the other lower animals and the dogs, the cat, they can hear. That means they can predict the earthquake. Actually, they'll be restless and they'll be screaming for letting them go. So all this can happen with lower animals. Because they can feel or they can hear the seismic waves that will arise through any natural calamities. Okay, so we should always observe our lower animals keenly. Why it will be restless and all, so that it saves our life too. Okay. Next, middle ear is exposed to atmospheric pressure through the. Your options are tympanic membrane, external auditory canal, pinna, or Eustachian tube. These are the options. Your time starts now. Time is up. Eustachian tube is the correct answer. See, middle ear is exposed to the atmospheric pressure through pharynx, actually nasopharynx, through one tube called as Eustachian tube. It's a fibrocartilaginous tube. Whenever we are talking, swallowing, okay, or we are taking a deep inhalation, the time our middle ear will be ventilated by this Eustachian tube opening. Usually it will be kept closed. So whenever air is required to fill up the middle ear, that time it will open up to fill up the air in the middle ear, so that the tympanic membrane is kept optimal in position. Okay. Tympanic membrane, if it is ruptured, that is abnormal, then it can be communicated to the atmospheric pressure, but normally it is through Eustachian tube. If at all there is a perforation, then obviously this also will be correct, but this we are talking of normal. Okay. Next question. Semicircular canals are filled with. Options are cerebrospinal fluid, endolymph, perilymph, mucus. These are the 4 options. The time starts now. So the answer is endolymph. So you should note that the semicircular canals, which are 3 in number, anterior, posterior, and the horizontal or the lateral. So anterior is also called superior by some authors. Posterior is just called posterior. The lateral one is also called horizontal. These are the canals. They are the membranous structures, membranous labyrinth. So they are filled with endolymph. If the same question was semicircular ducts, then the answer would have been perilymph, because ducts are bony part of the inner ear, bony labyrinth. But semicircular canal is a part of membranous labyrinth. So just if you can imagine one snail, the snail will have a shell, right? That shell is bony part. Snail itself is soft, right? Yeah. So within the shell there will be perilymph. Inside the snail there will be liquid, right? That is called endolymph. So this semicircular canal is like a snail. It's a soft tissue inside that endolymph. Hope you understood this. Next, speech audiometries are normally used to determine. Options are ear conduction and bone conduction thresholds of hearing, speech reception thresholds, ear conduction thresholds of hearing, bone conduction thresholds of hearing. Your time starts now. Time is up. Speech reception thresholds is the answer. The speech audiometers, okay, they are used to note the speech reception threshold of a particular individual, so that suitable hearing aid can be given to this person. So this test is done for that. Okay. Next, bonus test. Just observe this picture. Here the identity of the child is covered. Okay. Just observe this picture, the ear only. Okay. The time starts now. You should just tell what do you feel this ear, what abnormality or what normality, what is that condition called as. The time is up. Few more seconds I'll give. Okay. If you are told outstanding ear, see this ear is projecting beyond the face and the skull, and it's almost like forward, right? So it's called as outstanding ear. It is also called as prominent ear. Other name for this is protruding ear. So all these three things means the same. Outstanding ear, it is standing out of the face and the skull from the rest of the body. If at all the person head shaves, it will be the most prominent part of the head and neck actually. Prominent ear, also called as protruding ear, because it's protruding out, and it is the most prominent feature. Just now I told. So this actually is normal, but cosmetically it is not good. So most of them will undergo cosmetic surgery, that is otoplasty, that is reconstruction surgery or plastic surgery of the pinna, so that it is placed by the side of the skull. Properly it's placed by the side of the skull. Instead of facing forward, it will, after the surgery, it will face outwards. Okay, so that surgery is done at the age of 6 years. Like and share this video with your family and friends. Subscribe to my channel, press the bell button to get the latest notification of video updates. Thank you once again.